Hey there, Dr. Bennett here, Village Family Clinic Director here. We're going to talk to you about getting a good night's sleep. So, practicing over 21 years, one of the most common questions I get asked about how to get a better night's sleep. And we're going to talk about that today. So, just bear with us. It'll be a really great presentation, some helpful, practical sleep tips. Get a pad and paper out and take some notes because this is going to really help you get a better night's sleep out there. So, what is sleep? Sleep is a basic human need, right? The body does not heal for not sleeping. A lot of times patients come in with back pain, neck pain, and they wonder why I'm asking about their sleep so much. And the reason is because if you're not sleeping, you're not healing. So your body only really heals in its sleep. If you cut your finger, you'll notice you kind of wake up in the morning, it looks better than when you went to sleep. That's because most of the body's healing is really done during sleep. So healing's done during that. It's also a way to time out for busy routine. Something your body and your mind, more importantly, needs to reset, restore, refresh, and replenish. So really a lot of our healing and getting better happens during sleep. So what is the sleep cycle and how does pain affect that? So most common reason for not getting a good night's sleep is actually pains. So that's why as a chiropractor, we'll dive into a lot with patients. People with chronic pain is the number one reason why you're not sleeping. So it's not stress, anxiety, those things. They certainly do happen, but the number one reason is actually pain. It's not stuff people don't even realize. They're not realize that their neck or back is what's keeping them up. But people with chronic pain don't get as deep a sleep. They wake up more often and getting less efficient sleep. So you might even be thinking you're sleeping through the night, but you're not getting good night's sleep. So you're not feeling well rested. You're tossing, turning, getting in weird positions, and not really getting good restful sleep. So pain is number one reason why people are not sleeping well. So how does sleep affect pain again? So short sleep times, fragmented sleep times. So again, not sleeping 7, 8 hours, waking up a lot. Having pain at night is the number one cause for that. Not sleeping well then creates more inflammation. So we get stuck in this vicious cycle. Let's say your back hurts, so we're not sleeping good. You're not sleeping good, so your body's more inflamed. It's not healing, and the back doesn't heal up. So getting our more sleep habits, poor sleep habits lead to less active days, which means that we get stuck in this cycle. So you didn't sleep well, so you don't feel like doing much during the day. We don't exercise, don't move around much, and then you didn't use your body enough, so you don't sleep well again the next night. And also, if you do have back pain, neck pain, those types of things, we're not moving, which we found is actually making these problems worse. So it creates this like vicious loop or cycle where we're stuck in this anti-sleep pain cycle. So when you sleep well, you're going to wake up feeling refreshed, alert, ready to face your day. When you don't, pretty much everything suffers. We've all probably been up late with kids or family, realize we're not in our best mood the next day. Maybe our temper's a little short, a little less patience. Everything suffers when we're not sleeping well. It also we're not renewing their functions. It's also a period where growth and repair happens, as I mentioned earlier. So, like, if you really didn't sleep and you cut your finger, it's really like going to take forever to heal. So, most of the repair, healing, and for children and younger people growing is happening during your sleep and deep sleep. So, it's not just, taking a nap. You really got to get that deep sleep waves, which we'll talk about a little bit later. Good sleep is the key to vital health. So, it's going to really affect all your health. So good sleep is not merely, closing your eyes, but it's the process of really falling and staying asleep and going through the proper sleep cycles to get your brain function working right, your hormones, your rhythms, and everything else. So it's really more complicated than we may be thinking. So again, how much sleep do we need? So a lot of people are really off on this a lot. I'll do consults with children. We do treat infants. I just had a colicky baby, hadn't slept, a couple adjustments, kids sleeping again. But so babies, 16 hours a day. So a lot of times do hear infants not sleeping enough. They need their full like 10, 12 hours at night and make up the rest in naps. So little children are going to need 2 naps a day and a good 12 hours of sleep. Teenagers, we all know how hard it is to wake up a teenager. They need a little more sleep than adults, about 9 hours a day. So no playing on their video games till 1 in the morning. Got to get some 9 hours of sleep. And adults are going to need 7 to 7.5 hours. So we've heard that 8 hour thing a lot. That's kind of an average. As we get older, you actually need a little less sleep. So 70-year-old is going to need less sleep than a 25, 30-year-old. So adults, we're going to aim for 7, 7.5 hours. Everyone's a little bit different. We're going to get in these proper sleep cycles, getting a good circadian rhythm, which we're going to talk about in just a minute here. So again, there's the chart, 16 hours for babies, teenagers, 9 hours, adults, 7 to 7.5 hours. So what's going to mess up that clock? Light and temperature are one of the big things. So now we're going to talk about some other things about this, but now with the devices in our face, that is a big problem with sleeping. So people have their iPads and iPhones on at 9, 10 o'clock at night. That light, your body thinks it's daytime when it's actually dark out, and it's throwing off our normal cycles there. Other factors, things not getting sunlight throughout the day. So winter's a little harder. Electromagnetic waves, frequency, and when we're eating, which we'll talk all about. So the big sleep stealers here we're talking about. Number one, we talked about is chronic pain for sure. By far, it's like 70% of sleep problems are due to pain. And again, you might not realize it that your neck, back, elbow, knee, or something is causing you from not sleeping. Of course, psychological factors like typical stress we talked about, lifestyle stress, shift works. We do a whole 2 hours on that. But working shifts, night shifts, switching shifts like policemen, firemen, that stuff is really tough on your body. Jet lag is a real thing, so we're changing time zones, long flights, that can affect it. Environmental interferences, sunlight in your room, too hot, too cold, lights, etc. Again, number one by far is physical factors. So there's a lot of aches, pains, strains. Those are what's keeping most people up, and a lot of medications as well. So you got to check your medication list. There are a lot of medications that don't allow us to get a proper night's sleep or mess with your sleep cycle. So that is something to check as well. So why is sleep so important? We talked about that, but the three main functions really to keep us alive are eating, breathing, sleeping, and drinking. It's the most important part of recovery. Again, nothing really heals if we're not sleeping, whether a back pain or a cut on your finger. Healing is mostly done in your sleep. It's also the most important of circadian rhythms. So the body's natural rhythms throughout the day. We have awake periods, sleep periods, high activity, etc. So the sleep is obviously really important for that. Over 50 studies have been done that show that mental performances, reaction time, concentration, memory, and reasoning all decline as sleep decreases. So it's not just not feeling well, your reaction time's slow, whether you're driving, concentrating, memory, reasoning, making good decisions, etc. All will be affected by improper sleep. So it's very, very important. So you're not alone. It's a huge problem. It's one of the biggest problems in the country. Over 6 million Americans are looking on the internet for sleep. That's an old stat. It's gotten worse. 60% of people have problems a few nights a week with sleep. Most common problem is insomnia, not able to fall and stay asleep. Most common contributing factors people state is stress, 30%, health problems and pain, 22%. Again, if we actually dig into that, some other ways that the health problems are the number one reason. Light, noise, and temperature are a big thing. Partner sleep habits about 12%. So I don't go a day without hearing a wife complaining, usually the wife complaining about the husband snoring, keeping her up, tossing, turning as well, being anxious sleepers. So that's another thing to consider we'll talk about as well. All right, so most adults are sleep deprived. Average sleep's about 7 hours. 35% of people will sleep more than that. They're going to sleep 8 or more hours per night. 36%, so more than a third, are going to sleep less than 6.5. So we need a minimum of 7.5. People try to compensate by taking a nap on the weekends. Studies show average nap's about 40 minutes, but contrary to what people might tell you, cannot make up missed sleep by taking a nap. It just doesn't work that way. It might feel good, and some naps are okay, but you can't say I only slept 6 hours last night and take an hour nap today, and that'll be 7. The body doesn't work like that. We need that 7 straight hours, 7, 8 straight hours. Some more about napping. People over 65 and older, 53% report taking a nap, which is quite a high number. Between 30 and 64, it's about 35%. 18 to 29-year-olds, 41%. So it's quite a bit of people are napping out there. Night shift workers is really tough on your body. They've shown people working night shifts decrease life expectancy by about 10 years. So working night shifts can take 10 years off your life. So if we can get away from that, it's obviously a good idea for your health. But you can see how much worse it gets with night shift workers. 77% are getting less than 6 hours. So the vast majority are getting less than 6 hours. Again, we're aiming for 7.5, so that's huge. Almost 80% are getting less than 6, and we need 7.5. 44% are getting less than 5 hours, and also they tend to take more and also longer naps. Sleep aids, sleep medications. A lot of there's a lot of problems with the sleep medications. A lot of weird stuff goes on with those. 1 out of 4 U.S. adults have taken a sleep medication, more common in women. As we get older, the sleep medication use increases. It's harder for people to sleep. There's over-the-counter, prescription, both, and about 14% of people take alcohol to fall asleep as well. So it's a big problem. Insomnia is by far the most common problem that we're going to see. That's difficulty falling and staying asleep. Sleep apnea is a big problem. It's getting bigger and bigger. That's where the airways are restricted, either through the nose or the mouth. Sleep deprivation, again, by choice or your schedule, that kind of thing. So we're talking about some sleep strategies, relaxation, life changes, and treatments that are available for you if you have these issues. Sleep. So again, insomnia is number one problem people have. That's the perception or complaint of inadequate or poor sleep. It's usually due to one of these issues. So it's kind of different. I always ask this too: is it trouble falling asleep or staying asleep? Keep it as simple as I can. Difficulty falling asleep, waking frequently through the night and having trouble going back to sleep, getting up too early, or feeling unrefreshed sleep. So different reasons for this, which we'll talk about as well. So what causes insomnia? Being older, as we get older, tends to be a bigger and bigger problem. Female are almost 2 to 1 versus males for having insomnia. History of depression is a big issue. And again, nerve pressure, nerve pain. So the number one is really physical problems. Number one really being back and neck problems. That's, as a chiropractor, how we can talk about this. So the number one reason really people aren't sleeping is neck and back problems. Transient insomnia means it kind of comes and goes. Things like stress, we all know something bad happens, you get a car accident, something like that. We're not going to sleep good that night. Noise in the area, you got noise, temperatures, changing surroundings, jet lags, and medication side effects is often something people forget about to look at as well. Chronic insomnia, it's going to be mental and physical, so it's usually a bit of both. So we have stress, anxiety, those types of things, also combined with back pain, neck pain, and those types of things. Again, we talked about that anxiety cycle. I didn't sleep good, so we're worried about sleep. Then we don't sleep good, try to make it up with naps. So we just kind of get stuck in this endless loop. Caffeine is one I usually tell people about after 3 o'clock. We don't want any caffeine, really, probably even earlier than that. So I'll tell people tell me they have trouble sleeping. They're drinking coffee after dinner at 6, 7 o'clock at night. That was kind of an old-fashioned thing to do, have a cup of coffee after dinner. Bad idea. Alcohol or smoking before bedtime. So if you are a smoker, nicotine is going to keep you awake a lot of times. So we don't want to have a cigarette or whatever else right before bed. Alcohol, I know sometimes like a little bit of alcohol might relax you, but once you start having more than a glass of wine, that actually disrupts your sleep cycle. We don't go into the deep sleep cycles. Again, excessive napping or regular sleep patterns, not going to bed at the same time, taking too long in naps. And again, the number one reason is going to be is a chronic muscle or nerve problem. So what else about insomnia? So as we get older, again, we talked about it gets more and more likely to have trouble sleeping. Women twice as likely as men, and depression is also a big risk factor. So it's always a good idea if you're having real troubles to get a sleep study done. They're actually now at-home kits. They'll mail you a kit. We put some pads on our chest and some things, and you do a sleep study right in your own home now. And they mail it off. A doctor that specializes now will read it for you and let you know. So you don't have to sit in one of those sleep labs anymore. So again, as soon as we can change this, positive mental attitude goes a long way. We want to try to change that. We're going to go a lot about it into it in a minute. Having a good sleep strategy. So really having a good routine. At 8 o'clock, and some of the staff here make fun of me, but my phone goes on do not disturb at 9 o'clock at night. That's do not disturb. That's on the iPhones. You can hit a button if it's emergency, it'll go through, but everyone else gets that message. It's on do not disturb. Mine goes on at 9, so people might be texting me work stuff or questions. 9 o'clock, it's off. I don't want the screen on. I'm getting ready for bed. That's my sleep routine. It's right at 9, and you can ask my staff. So to get routines like that, getting the electronics down and the screens off before. As some sort of good routine, whether it's chamomile tea, it's a bath before, some relaxing routine, and getting in a good nightly routine. A lot of natural therapies and stuff you can take, we'll talk about. And again, take care of the physical problem. So the number one reason is something's aching, pain, keeping you up. You might think your back's just bothering you a little bit, but at night, your body's kind of worrying about it, so to speak, and thinking about it, and you're tossing, turning, and not sleeping well. So make sure we're getting rid of any of those kind of problems. So sleep, again, what does it do? It's going to improve our nervous system, prevents and reverses depression. So good night's sleep is going to help with depression. Hormonal balance, increase your concentration, boost your immune system. Getting good night's sleep is tremendous for immune system. Reduces cholesterol, improves learning memory, and maintain emotional harmony or just everything being at peace. So again, baby boomers are kind of the leading trends for this. We'll talk a little bit about mattresses because I got asked like 10 times a day what kind of mattress is best. So obviously you don't have a good mattress, and I'll start talking to a patient about sleeping a couple minutes in. How old's your mattress? Oh, it's 20 years old. Well, that's probably a big part of the problem. So mattress, I tell patients all the time, you spend a third of your life in your mattress. You're spending, 1/20th of your life in a car, and you're spending 50, 60, 80, $100,000 on a car. If we're in a mattress for a third of our life, it's worth spending a couple bucks on. But you don't need to spend a fortune on it. We'll talk about it in just a sec. So mattress stuff has changed a lot in the 20-something years I've been in practice. Comfort and firmness is really important, real good, important health. Memory foam has really taken over the market and is most recommended. I have memory foam. My kids have memory foam. I do recommend the foam mattresses. You do not have to get the expensive Tempur-Pedic. There's a ton of other ones out there. Getting a little bit better bed sizes. You do room, a little bit larger mattress, especially if you have a partner with you. It's going to give you more room. We're talking about foam mattresses. The thicker they are, the more support we're going to get. However, I tell people to watch your bed frame, make sure you can fit it. But technically, the thicker the foam, the better off they're going to be. And pillow top mattresses are also okay. I generally recommend the foam. But pillow tops are okay if we have a nice firm spring underneath with a thin pillow top. It's another way to go. But if you're looking to get one, I would definitely go with these new foam mattresses for sure. So what you sleep in is going to make a huge difference. Obviously, doesn't get enough support to the spine, and we're sinking in too much. It's going to cause a lot of back problems. You're going to have improper spine alignment. Then the muscles will not be able to relax, and you're not going to sleep. Proper sleep mattress is going to keep the spine nice and straight and even. Then the muscles can relax, and we can sleep. So it's not just about your alignment as a chiropractor here, but if your spine's supported, the muscles can relax, and that's going to allow you to sleep well. So it's not just about keeping alignment, it's about letting the muscle relax and get a good sleep. All right, so depending on how you sleep is going to depend on your mattress. So generally I ask patients during their consult, I ask everybody, back sleep or side sleep or stomach. Stomach's the one way we really don't like, especially as chiropractors. There's not a good way to sleep on your stomach without causing some back pain and pressure. Sleep on our back, we want medium firm mattress. Too firm on our back, I'm just going to push on the shoulders here. Too soft, and the hips will sink down, not causing good alignment there. So you want your spine to be nice and aligned pretty well. So not medium firm. I generally tell people if it feels a little too firm in the store, that's probably about right. You're only in it for 5-10 minutes, and then 8 hours a day for 10 years. You're going to need that support. So a little bit firmer than you probably think. Side sleepers can be a little softer because the side sleepers, we need those hips to sink in. We need those pressure relief. Again, the hips and shoulders are going to be into the mattress, so we want that to sink in just a little bit, but not super soft, trust me, right? Memory foam, we're going to be best at that, so the foam mattress should be good. Again, you don't need to spend $4,000 Tempur-Pedic. There's a lot of good $2,000 king mattresses that are fully foam out there. Stomach sleepers, again, I generally do not like that. Some people I know can't break it. I encourage you to try to break that habit. It causes a lot of stress on the neck. Just think about it. How are you going to breathe face down? So we have to twist our neck all night, and no matter what, that's going to cause some neck problems. But if we do stomach sleep ultra firm, we don't want any sinking into that because it's going to cause more back problems. Your back already kind of sags when we're on our stomach, and having a softer mattress is going to be a big problem. So we want a nice firm mattress. You can do a little thin comfort top if you want, but you want nice and firm. And a lot of times the spring ones are sometimes better for stomach because it gives that extra support. But again, I highly encourage you, if you're a stomach sleeper, to try to break that habit. So again, sleep problems are usually secondary complaint to some sort of musculoskeletal problem. Back pain, neck pain, elbow pain is really what's waking you up. People do best when they do sleep and relaxation studies along with some sort of treatment. So people take care of the neck and back pain, and doing some of these sleep and relaxation stuff we're going to teach you about is going to do really well. Over half of people that just did chiropractic care alone with no sleep stuff are going to get a better night's sleep. Just go to the chiropractor, get a 50% get better night's sleep, doing nothing else. Nothing we talked about, mattresses, relaxation, just going to the chiropractor. So that's pretty cool. If we do sleep and relaxation without chiropractic, less than half did better. So doing everything you can, getting a fancy mattress, all the relaxation, meditation you can think about, you're actually better off not doing any of that and just going to the chiropractor. We have better results. But obviously, you combine it, we're going to do awesome. So that's the idea. So again, misaligned vertebrae in the spine. We're not sleeping well, misaligned the vertebrae, or the vertebrae already misaligned, putting nerve pressure on. That's most likely causing sleep issues. Like 90% are coming from the back and the neck. So arthritis, people with arthritis tend to have worse sleep problems, 70%. More pain after sleep. I'll ask a lot during consults, do you wake up feeling sore and stiff? And the people with arthritis will typically tell me yes. Then we're going to get bad sleep and cause the arthritis to actually get worse. So it's going to create a lot of problems. It's important to reduce the joint pain as much as possible. We're trying to go to sleep. That last line is most important. So whether that's chiropractic care, we're doing laser therapy, any of that kind of stuff, we want to do that before bed to get all the inflammation calmed down so we can get some sleep and not cause problems to get worse. All right, so here's the crux of the presentation here. There are like 10 tips to get a good night's sleep. So again, we're going to avoid stimulants late in the day, no caffeine after like 2. A lot of these young people drinking Red Bulls and Monsters all day long, right? We got to get rid of that. We mentioned temperature a couple times. Most people's bedrooms are too warm. So our ideal sleep temperature is actually 68 to 70. But the thing is, if your room's 68, you get under the covers, now it's probably 72, 73. So a lot of times lowering temperature in a room can be the best thing for you. Regular exercise has been the best thing, one of the best things you can do for sleep. Just even go for a walk every day, riding a bike, something you can do. Reduce electromagnetic frequencies. That means your phone and iPads. I all the time, I'm amazed. I just had a gentleman, I can't fall asleep, trouble sleeping, and basically doesn't on his iPad answering emails at 11 o'clock at night, then he can't fall asleep. Well, if you're in bed and, good general rule is no electronics in the bedroom, that's a big one. Sleep in complete darkness. So a lot of times, like in my house with the kids, we have those blackout shades behind the curtains. A little bit of light come through makes a big difference. So it might be a little thing for you. Check the curtains. Maybe we have sheer curtains, little lights getting in, even from a street light or cars going by. So blackout shades, you put them behind the curtains, then put the curtains. That can make a huge difference. Going to the chiropractor just showed you that's more effective than any of the stuff you can do. Over 50% effective just getting to the chiropractor. Pretty cool. Journals, getting your thoughts out. A lot of people, especially when we're talking about women, a lot of women, those all these kind of thoughts and what we have to get done during the day is building up at night. Getting those all out on a piece of paper can really get some of that off of your plate. Get a bedtime routine. Again, like I said, I turn my phone up 9 o'clock. It's on Do Not Disturb. We're reading in bed. Maybe we have a cup of tea. Getting a good nighttime routine. One of the biggest problems is doing something different every night. One night I watch TV, one night I read, one night I go for a jog. Also, we did talk about exercise. Exercising late at night can keep you up as well. So don't do that. But get in a routine. It's 9 o'clock. My phone goes off. I read from 9:30 to 10. Lights are off at 10. It's kind of like what we do at my house. So get a good routine and stick with it for a while. Keep your bed for sleeping. So we're not talking about anything inappropriate here. We're more talking about people are doing work in their bed. They're doing projects. We're doing all kinds of other stuff. The bed is for sleeping, okay? And a mattress, good, supportive, comfortable mattress. I think we talked in another presentation, but 8 to 10 years is about it for a mattress. So I'll ask patients, and they'll say, oh, mattress is pretty new, and they'll, it's 15 years old. So it's probably lost a lot of its support. 8 to 10 years is a good timeline. So again, we're going to commit to these things for a while. I'll tell people some of this stuff in the office. They'll try it for 2 nights. It doesn't work. I want to encourage you to commit to doing it for at least 6 weeks. It's not a quick fix. Setting a routine takes some time. Your body takes about 30 days for a new routine. So we keep the stress out, no electronics, caffeine, all the stuff we talked about. There's a whole bunch of stuff in this presentation. Go rewatch it, but take 5 things out of this. Start it today. Try natural approach first. I think everyone's had experience with sleep medication. There's a lot of crazy side effects. I always tell a story. I had a patient wake up naked in a Lowe's parking lot. He was a contractor, and the sleep medication made him sleep drive to Lowe's because he goes there every day for his work, and was naked in his pickup truck in the parking lot of Lowe's. So there's some wacky side effects of that stuff. It's very addictive. It can be dangerous. Again, I had a patient with seizures from it once, etc. One of the things, and I don't sell this stuff or do anything with it, Calm is a great natural supplement. It's a natural magnesium. It's really helpful for sleep. They have a regular formula and a sleep formula. It's available on Amazon, anywhere online. Really inexpensive. You take a little magnesium before bed. Every day I have patients say I tried the pills, they didn't work. Magnesium doesn't seem to break down fast enough in the pill form, so I highly recommend you try the powdered form. All right, so if you're having a headache, neck pain, back pain, upper back tightness, numbness, or tingling, you probably have a physical problem that's interfering with your sleep. I said it's the most common reason you're not sleeping is an ache and pain. So if you're having any of these things, make sure you come on in and get us checked out. And again, here's a normal neck. We have a nice normal curve we see it on the neck. Everything's feeling good. You see the one on the right with the red. We've lost that natural curve to the neck from improper sleep position. It's causing nerve pressure on the neck. So we are some back pain, some tips. We're going to sleep on our side. I get asked this every day. We're going to sleep on our side with a small pillow in between the knees to take some pressure off the back. Sometimes reclining a little bit. Now, too much this causes pressure. So a lot of these new mattresses do this. You can also buy a wedge. That creates a nice angle, takes pressure out there, but not too high up. That'll start compressing your spine. We're side sleeping. Again, a little pillow in between the knees. You see she has that little pillow in between the knees. It's a tiny little trick that really helps align the hips and pelvis. It can take a lot of pressure off the back and the SI joint or that your hip region as well. Stomach, again, we don't like sleeping in the stomach. Try not to do it. But here's a little tip. Sometimes what will happen is that your low back's going to sink in there a little bit. And you see this woman in the cartoon there has a small pillow underneath her stomach to try to flatten out that spine. But again, you're going to see even the neck, even when we're doing that, it's still tilted up a bit. And it does create some neck problems. So try not to, but if you can't do it, that's for you. This is probably the best way. If your back's really killing you, I tell people, if you're really hurting, when they come in a lot of pain, this is what you want to try to do at least for a couple nights. We're going to have a flat on our back, knees elevated like that with a nice supportive pillow. If your back is hurting you, this is the way to do it. I'll even tell patients when they can barely walk, coming in, new patients, to lay on the floor like this for 20 minutes at a time. So pillows, we're going to talk a little bit about pillows as well. I know this is getting a little bit longer here, but loft, firmness, and materials are there 3 considerations for a pillow. So medium loft is going to take pressure off the neck and shoulders, but too much loft will push our neck up firm. Want a back. This for back sleepers. Medium firmness, too firm, too soft. We want to bridge that gap between the back of the head and the bed, and soft to firm to confirm. Side sleepers. So side sleepers have to fill this gap here between your neck and your shoulders. So we need a bigger pillow to fill that. So I got bigger shoulders. You have to fill that space with a pillow or you're going to have a problem. You want it pretty firm. You don't want our head tilting one way or the other. So too much pushing up or not enough, it's going to tilt the head. So we got to get that just right. It's really, really important. Here at the office, we have these adjustable pillows that are great for that. Stomach sleepers, again, we don't love it, but we're going to need a real thin pillow. So our neck is already pushed in to side and up, which causes a lot of neck stuff. If we have too big a pillow, we're pushing it up even more. So we need a very thin pillow. Real soft, real thin, like as little as you can handle. So you want just a small buffer between you and the mattress. Very, very thin pillow. So getting one of those orthopedic pillows in your stomach sleeper, it's going to really make things a lot worse. So you want a real thin, inexpensive, thin pillow to just do that. So there's a bunch of different materials you make out of pillow. Foam or hybrid foam are going to be good. Except for the stomach sleeper, we want something real compressible. Again, real thin, feathered, down pillow, something very, very thin, minimal in there. All right, so general tips, again, mattress 6 to 8 years. Be careful getting it out of bed. I often kind of coach people on how to get out of bed, and a lot of times if you've been in our office in real bad back pain, I give you a couple stretches to do before you get out of bed. I'll tell people, I don't care, you have to pee, whatever. Do this for just a couple seconds. So everything kind of tightens up in our sleep, and we just go smack our body weight on our back, that really causes a problem. So it's just a little light stretching before you get out of bed can make a big difference. I tell people all the time when they're in pain, it doesn't matter how bad you go to the bathroom, just do this for 20 seconds and stretch the muscles before we just put our body weight on it. And again, stretch before bed. So really, people in a lot of pain, I always tell them right before you go to bed and before you get out of bed, do these couple quick stretches. Again, nighttime routine, we know it's 9 o'clock, phones off, we read, turn the lights off, get a nice routine. Reduce stress, meditation's great, yoga, all that kind of stuff as well. So that's it. So there's a lot of information there. Hopefully that helps you out a little bit. If any questions, always feel free to ask me, and hope that we're doing well.